Hi, my name is Susana Arciga. I'm a physical therapist at the Marquette University Physical Therapy Clinic. I'd like to review some sleeping postures and positioning, just with use of good supports. And this is just in case you're experiencing a little bit of pain, or if it's a review of some of the postures and education that you've received before. Now I'll be reviewing sleeping on your back, if that's your preferred position or a position of comfort, and using proper supports just to help alleviate any strain on your neck and or back. So first I'll start with the neck again. So getting the right height of the pillow and right support is going to be important. As I mentioned in sideline, it needs to be above the shoulders, so don't really ever have the pillow below the shoulders. You really want to support the neck here, so I know it's supported. Now with Rose, typically I would like for it to just be just fairly neutral. And when I say neutral, that your head's not tilted up or that it wasn't tilted back. And the other thing I tell my patients is that if there's a sheet, like a flat sheet on top of your face, that it's once again rather horizontal or parallel to the ground. So some people, if they have very acute symptoms, meaning that there's a flare-up of some pain and it's just very finicky, and that you need a lot more support, what I'll say is you can bring your head up slightly. So I'll use another pillow to demonstrate the height that you would need. Now at home you do not need to use two of your own pillows, especially if they have good, medium, and firm support. But just find a nice, thicker, well-supportive pillow. So here we have a nice flat pancake, about like a half a pillow size, that I will stuff in here. So that would be probably the most I would want to see somebody supported and tilted upward, if that. As you can see, she might be just a little bit higher, but she's not all the way up here, because that can actually put more strain on your neck down here. So Rose, I think, does better just with this here. And now an extra support that feels very nice, especially if your neck's just starting to get a little sore or if there is some pain, is a towel roll. Now with this, as you can see, a nice hand towel once again. And what I like to do is I like to go across this way. And then I'll fold it over. Once again, it's not a roll, it's more of a folding over. And it doesn't need much support because you don't want something pushing up into your neck. So this is like making your own orthopedic contoured pillow, customized to your neck. Now you have to look at the thickness of your hand towel. So you may need to use two if they're very thin, or just the one should be fairly good. And Rose, here, let me just show. So what I would do is I would put this at the bottom part of a pillow. And it goes the length of it, and hopefully you can tuck it in right at the very bottom. And here we go. So this kind of came undone. And so just having a little bit of support there would be pretty good. How does that feel? Good? Okay. I feel like for her neck, if I added another layer, it would be too thick. So you just want to make sure that it's not kind of pushing you up and then tilting you back. So just a little bit of support, and it should feel good. If it starts to bother you, or if it feels uncomfortable from the get-go or within 5 minutes, then that's too much support. So now her head is set, and then next I'll show you good support and positioning for the lower half to protect your low back.